Welcome to KMET 1490 AM ABC News Radio and the Southern California Business Report with Yvette Walker, a show dedicated to highlighting successful Southern California businesses and the people behind them.
Welcome and thank you for joining the Southern California Business Report on ABC News and Talks, KMET 1490 AM, 98.1 FM, and KMET TV. I'm Yvette Walker, live, blasting our signal from the center of Southern California, serving a population of over 25 million. Get us crystal clear and on demand by downloading the free live streaming app on Google Play or the Apple App Store. As always, a huge shout out to the team, Mitch, Bill, and Sean. I love you guys. And to our special advisory committee, Bill Morris, UCI School of Business, Jose and Camila Rubio. Thank you. Also, don't forget to check out the Jay Kaplan Show on Fridays at 3, as well as the Aaron Michael Sanchez program, also every morning at 8. Today, I have the distinct honor and privilege of introducing two very important people that are going to talk to us about some very critical things happening in our community and in the health of our community. Today we have Dr. Aileen Dinkjian and Dr. Andres Gonzalez. Dr. Dinkjian serves as the Executive Director of Population Health at the San Antonio Regional Hospital Randall Lewis Healthy Communities Institute. Aileen leads the development of population health management initiatives and provides leadership and oversight for the HCI and community outreach programs. Aileen serves to address the healthcare worker shortage and elements of the educational achievement gaps through HCI programming by creating workforce pipelines with students as early as middle and high school. Aileen has championed the translational science and public health workspaces and has a deep-rooted passion for disease prevention and community health. Aileen chairs the Health Equity, Diversity, and Inclusion Council and leads the Community Health Needs Assessment for San Antonio Regional Hospital. Aileen received her BA in Political Science at Cal Poly Pomona, a master's in Public Health at George Washington University, and a doctorate in education at USC. Dr. Gonzalez is a family practitioner, and he attended Weber State University from August 2004 to May 2008 and earned both a Bachelor of Science and a Bachelor of Arts degree. From January 2009 to June 2014, Dr. Gonzalez was a student at Universidad Autónoma de Guadalajara School of Medicine, where he received a Doctor of Medicine. He participated in a pre-internship program at St. Joseph's Medical Center through New York Medical College from July 2013 to June 2014 in conjunction with his doctorate program. At Mid-Hudson Family Medicine Residency in Kingston, New York, Dr. Gonzalez served as a family medicine resident physician from June 2014 through July 2017. Before joining the medical staff at Inland Physicians Medical Group, Dr. Gonzalez worked as a hospitalist at Mid-Hudson Physicians Health Alliance Hospital for the Hudson Valley, a position he held from September 2017. He is a board certified by the American Board of Family Physicians and the American Medical Association. He is also a member of the New York Society of Addiction Medicine, and Dr. Gonzalez also volunteers in the community to provide medical care to UN and uninsured people, to un and underinsured people. He is bilingual, speaking English and Spanish, and Dr. Gonzalez is married and has 3 children. Thank you both so much for being here today. I'm so excited about, the update you're going to be providing and an overall state of our basically community's healthcare status.
Thank you. Thank you for having us.
Thank you. All righty. So this is how we start. All right. I know that you're familiar, Dr. Dinkjian. You've been on the program before, so I will ask you first. Please talk a little bit about what led you down the journey and the career path to, pursue such a passionate career in community healthcare initiatives.
Yeah, so actually at a very young age, my first job was working for the city of Chino, where I was exposed to general programming, after school programs, families. And then I went through college and attended Cal Poly and decided, I want to be involved in civic engagement just because I love working in my community, volunteering, and spending time with people. And that's just my general love and passion with just being able to serve in that capacity. And so after graduating college, I became a coordinator for what was then, this was in 2005, a Healthy Communities initiative. And that was a very new kind of early coined term around that time, what we call like the modern age of healthy communities in 2005, 2006, because we were trying to address the obesity epidemic where children were dying before their parents. And so that really caught my attention, and I wanted to pursue a formal education. So I ended up getting my master's in public health because I didn't know what the framework looked like, and I wanted to see what can I do more to be a leader in this field. And fast forward, throughout time, I spent some time, I got my master's in Washington, D.C., and I came back, and I wanted to bring, everything that I've learned from the perspectives outside our fishbowl in the Inland Empire, because I was born and raised in this area. I wanted to serve in this community. And so bringing back what I've learned so much from my education and seeing how I could be a service in that end, by learning from my peers, by learning from the philanthropists that are in our community, the businesses and entrepreneurship opportunities that can build the workforce that is very much needed that we see today. So I'm really just driven, and I love being able to see what I can do more. It's rewarding for me. It doesn't feel like work, and I think that's where I lie. I feel like I've always been a civic leader, and I want to be able to give back in some way. And I think being able to see children thrive and parents and families obtain resources and access to healthcare, access to the needs that they to be successful in their own home, whether it's learning how to eat well or cook meals that are helping feed young bodies to be to thrive in society. I think it's really important to continue the education in our community. And so it's one of those where we'll talk a little bit later. We want to educate those that are from the community, from this area, and bring them back and keep them in this area. So that's a goal. And I think in general, to build a family and to build a community, we really have to take care of our community in that sense.
Absolutely. Thank you so much for sharing that. Can you please talk a little bit about your journey, Dr. Andres, and kind of what spurred that passion within you to become a family practitioner?
Yes, exactly. So same thing. My journey, I feel like it started at a very young age. I think what happened was I remember back when my parents would actually go to a doctor's, appointments, and they would always take us, us kids along because they wanted us to translate. And my thinking back was like, well, wait a minute, why doesn't the doctor speak Spanish? I couldn't understand that piece, right? And so I think at a very young age, I started kind of seeing that that need, that gap, that there wasn't any Latino speaking physicians. And, growing up in like kind of like in a migrant area, I saw that there was a huge need. So I think that's where my drive came from, my motivation. And eventually I wanted to be able to provide that service in their native language. And I think that was one of my biggest things for me, is that just to be able to do it on my own and to do it in their own native language was the biggest thing, and to kind of help bridge that gap. I think that's what kind of eventually ended up motivating me, and to be able to kind of come full circle and to be able to be providing that service now.
Right. So similar stories, right? You've identified gaps or opportunities, and you took it upon yourself, as Dr. Dinkjian said, take those leadership roles to fill those gaps and to address those needs. That's absolutely remarkable. I love that story. So let's talk a little bit about what exactly the Community Health Institute does and what it exists for, right? It's a relatively new institute at San Antonio Regional Hospital. So let's talk a little bit about what that is, Dr. Dinkjian.
Yeah, so thank you, and so it's the Randall Lewis San Antonio Healthy Communities Institute, which is in partnership with Randall Lewis, and the goal really is to create a healthcare workforce. And we've kind of seen, even through the pandemic, the shortage of healthcare workers, specifically in the Hispanic, Latino, Latinx, Latina population, where the disparity was just so great. And our goal really is to create those workforce pipelines, meaning that we want to educate students. So we go into the high schools, we teach students about wellness that starts with them first and foremost. How do you take care of yourself? What are some of the, what does nutrition mean? How do we even get to a point where we take care of ourselves to be able to take care of others? And so we expose the students in locally in Chaffey Joint Union, Upland Union, Upland Unified, and in Ontario, Montclair Unified Districts currently to provide them with more information, and it's fun, and they get certified, for example, with food safety certification, so that way they walk out of high school with like, hey, I got certified, now I can do something with this. And so we also offer young healthcare professional development sessions, and these are like 8-week programs where we go in and teach them how do you build a resume, what can we do to help support you with your interviewing skills, and why is it even important. So, and a lot of times these high school students don't really understand or even know where they want to go right after they graduate. And so this is just an opportunity to see where they are. Is it, what's most important and pressing for them to maybe get into? Because one of the things that when we did a mental health fair at one of the schools, some of the questions that I asked was, what motivates you, or who motivates you? And a lot of them says their family, and specific activities that might get them up in moving forward with their daily activities. But again, the concern that have been raised from these students are also like the violence that's occurring in society, and it's kind of like, how do we teach them, like, well, what's your place in that? How do you overcome or become a leader in these communities to help support your peers? Because one of the areas we really hone in on is mental health. And we've seen that as a priority in our region, and being able to go into the schools and work with the school districts is really key for us to help extend that information, not only with the students, but through their families as well.
Beautiful. So how is it that you're collecting your data? Because I understand that, you've had, your study conducted for the year to share with us, today, in terms of, where are the opportunities, what are the challenges, and what are, some plans to move forward on addressing some of these challenges and opportunities, right?
Right.
Please talk a little bit about how that data is collected.
Yeah, so we just recently completed a community health needs assessment, and this is a collaboration with multiple community-based organizations and other hospitals. San Antonio Regional Hospital was a part of that, and Inland Empire Health Plan was a big part of that in leading this. And so we've conducted listening sessions, focus groups, and surveys just to get a general understanding of what are the key priority areas and burdens of diseases that's prominent in our community. And we're finding that cardiovascular has popped up as one of the areas that we need to focus on, and including mental health, maternal infant child health, and behavioral health. And so, and what we're seeing is that, in the Inland Empire overall, we have a population of about 4.6 million people. And we're going to have a big growth of multiracial and Hispanic populations within the next 5 years. And so when we have a growing population of people that are going to be 65 and older, and maybe a decline of those between 1 and 17 that are leaving our region, the goal is really to also keep those folks in our region to help support the ones that are also getting older, if that makes sense. So if we're looking at the readmissions in the emergency departments, we're seeing people are using that as their first point of entry. And it's because they're not going directly to their primary care physician, which Dr. G could probably speak to, what he's
Right.
seeing or not seeing. And it's really important for us to figure out what are some of the implementation strategies and who should we be working with and prioritizing to get to be able to provide the necessary resources. And there's a lot of the community was heard, and there's concerns with job security, concerns with their overall access to basic needs, and these are things that that San Antonio has made a commitment to make sure that we are meeting them where they are, whether it's providing them with the mobile clinics, which is a goal that we have forthcoming. And it's really key. I think it's building a career pathway, even just starting with the students, and having someone who, if you have a family member that looks like you in the clinic, you're more likely to probably be open and honest with them and tell them what your concerns are, as opposed to someone that doesn't look like you and you're just kind of like, well, thanks, but no thanks. I think I'll try to treat myself at home, which we want to prevent. So a lot of education really still needs to be out there.
Right. And as Dr. Gonzalez mentioned, in his experience with his parents growing up and being, present at the medical visits as a translator, right? Dr. Gonzalez, please talk a little bit about what you have seen in your ability to interface and communicate directly with the community that you're hoping to serve, because, like you said, you saw where the disparities were, you saw where the challenges were, and how that impacted your family. Please talk a little bit about what you've seen on the ground and what a difference it makes to be able to communicate effectively with your patients.
Yeah, and exactly. And I'd want to start by saying that that's actually what drove me to my specialty that I ended up selecting, primary care, because I knew that that's where I would probably be able to provide that service, more useful, more of a resource to patients themselves, as opposed to being in a specialty. Not that I don't have anything against any specialties, but I kind of went back to my roots on that. I asked myself, where do I think that I'm going to be more of an asset to the community, and eventually where, what started this whole thing, right? What started the whole motivation? So yes, I think that's the most important thing. One, we're talking the same language, like Dr. D said, I mean, we're basically, we're in the same language, we're in the same, ethnic background. We look like each other. So, I mean, you're going to end up forming a better relationship. That people are going to, want to, be able to know that they can trust you. And so I think that's eventually what again has kind of made me, want to choose this career. And I think that's ultimately what patients look for too, to be able to, make that relationship. They come in and you're speaking their same language. I think they can obviously communicate a lot easier. They can express themselves. They feel like you're actually listening to them and not just, a number or another figure or something. So I think that that's ultimately, what the service that I'm being able to provide.
Right. I would imagine also that, just the cultural sensitivity, philosophy, attitudes around healthcare in general, and kind of understanding that has been helpful as well.
Yes, of course. Yeah. I mean, just, being able to just kind of maybe know some of their cultural, things that's also been important too. So just kind of bringing it all together. I mean, I think that's kind of what I'm able to provide, and the kind of, the service that I feel like patients should get too, and so I think that's ultimately what kind of brings it all together for me.
Right. And so what I love about this interview today is that we have the opportunity to speak with, obviously, two distinct figures in the medical community, right? Dr. Dinkjian, who focuses on the bird eye level of, the vast collection of data, refining it, plotting it out and looking out for the trends, right? And where those opportunities exist. Whereas you are actually on the ground, interfacing direct and have that real time, live feedback of what is actually occurring in our community.
Yeah, of course. I mean, just, being able to be that face, like I said, being able to provide that service, the connection, the resources, being able to bridge those gaps. I mean, ultimately, this is what has motivated me and what has driven me to be able to be in this position. And, I mean, it's a really easy job. I mean, it's like, I can't believe I sometimes even get paid to do this. It's, and so, and it fits my personality too, as far as, being able to communicate with these patients and being able to provide, the resources and the the medicine that they're supposed to be, that they should be privileged to get, and so I think that that's ultimately what's driven me and what kind of keeps me grounded at the same time too.
Right. And so can you share with us, Dr. Gonzalez, maybe like that aha moment where, like you said, right now, you just mentioned, I can't believe I get paid for this, right? Because you love what you do. But can you please, share that aha moment when you're in the room with the patient, speaking with them in their language and, interfacing with them and giving them the very critical, medical advice, treatment, whatever it is, when you said, wow, this is exactly what this whole journey was meant for. And this moment has really brought it to full circle.
Yeah, I mean, there's many examples that I can come up with. I mean, on a daily basis, whether it's in the hospital, an acute care hospital, whether it's in my clinic, just being able to talk to them in their own language is huge for the patients themselves. Like I said, they're being able to express themselves a lot easier. They can be a little more detailed as far as what they went to the hospital for, or what they're in the office for. So I think that alone is my biggest thing as far as where I can say that I'm obviously being valuable and we're being able to build that relationship. So I think that's, in many cases, it helps me a lot as far as, being able to provide that service.
Beautiful. And so is that what the data is showing today, Dr. Dinkjian, that cultural sensitivity and the ability to interface, in the community's own language have an impact?
Oh, absolutely. Yeah. So, I mean, all of that plays a role in being able to have what we call, cultural competence in the workplace, and cultural humility is the big one that I think we're kind of turning into, is just how do we make sure that people do have reliable transportation and are thriving in a natural world that we live in. And again, these are things that we're hearing, and the data is showing this, that there is concern about humane housing, meaningful work, which means that, am I working and can really provide for my family, or am I working and still can't make ends meet? And so what is it that we can do? We can talk a little bit about like the contribution that we make in society, but also the distribution of wealth, right? And it's kind of like we're fortunate when we have those that are in the top tier of their wealth and can distribute it back into the community by being philanthropists, right? And helping build healthier communities, building out these spaces that are all over the Inland Empire to make sure that we have healthier food choices and options and opportunities to walk. And those things are really built around the environment that, in order to thrive, we have to have those spaces available to us, especially if we don't have transportation available to us. But yes, we need, these are called, our vital conditions that really speaks to what makes a person thrive in our community. And so we talk about, the term of upstream. We need to go back and, before they even get into the hospital, how do we make sure that they have everything they need? And one thing that San Antonio Regional Hospital is doing is that, once you're discharged, if you are admitted to the hospital, is that we have a Care for You clinic where you can be seen with a primary care physician immediately following your visit. So that way we do keep you supported, whether it's, then giving the wraparound services that might be necessary to help support any financial concerns with billing or insurance and things like that. So, I mean, I think it's key that there's action behind the data that we're doing, right? And so, and it's, and we're continuing to listen, and things change over time. And so I think collecting the data, and this is something that we have to do, but also want to do and need to do, is continue to listen to our community and what they're saying.
Beautiful. All right, we're coming up on the break. So for everyone listening, I'm Yvette Walker on Southern California Business Report on ABC News and Talks, KMET 1490 AM, 98.1 FM, and KMET TV, talking to Dr. Aileen Dinkjian, Executive Director of Population Health at the San Antonio Regional Hospital, Randall Lewis Healthy Communities Institute, and Dr. Andres Gonzalez, a family practitioner at Inland Physicians Medical Group, sharing an overview of the state of our community's health, offering insight, identifying challenges, and recommending solutions to current healthcare challenges when we return.
Ontario International Airport is onto a better way to fly with over 65 daily nonstop flights to more than 20 major destinations and the easiest airport experience in Southern California. Visit flyonto.com/Ontario to learn more about Ontario International Airport today.
Hi, I'm San Bernardino County Sheriff Shannon Dykes. If you're looking to start an exciting career in law enforcement and make a difference in your community, we are hiring dispatchers, nurses, deputies, laterals, and many more. For a complete list of our jobs and more information, visit sheriffsjobs.com.
It's summer, the sun is shining, and now's the time to make the most of your solar panels. Don't lose up to 50% of your solar panels' efficiency just because they're dirty. Get the most out of your solar panels and call my friends at Solar Panel Cleaning Specialists at 951-663-7502. That's 951-663-7502. Mention this ad and receive your discount. Offer expires December 31st.
The University of La Verne is rated first in California for alumni satisfaction. Learn more about accelerated programs offered online and on campus in La Verne, Irvine, Ontario, Burbank, or College of the Canyons. Visit go.laverne.edu. The University of La Verne. go.laverne.edu.
Cal State San Bernardino is home to the only school of entrepreneurship in California. With globally ranked degree programs, you can start your journey today to become a successful entrepreneur. Learn more and connect at entre.csusb.edu.
City of Hope is driven to making a difference in the lives of people with cancer and diabetes. We accomplish this by conducting innovative research and providing outstanding care. If you or a loved one has received a cancer diagnosis, go to cityofhope.org to learn more about how our innovative approach could change your outcome.
Every 2 seconds, someone needs a blood transfusion. Be on the giving side. Livestream Blood Bank supports patients in 80 Southern California hospitals. Call 1-800-TRY-GIVING for more information and to set an appointment.
Hi, Ray Lance from the Diamond Center in the Claremont Village here. For 3 generations in our family business, we've been helping our clients find the perfect gift, and this year we're doing something special. Shop with us between November 25th and December 17th, and if it's 83 degrees or more on Christmas Day, you get your money back. Come find your perfect gift this year at the Diamond Center in the Claremont Village or Lance, L-A-N-T-Z, diamondcenter.com, and we'll all hope for a little heat this Christmas.
Welcome back. For those listening, I'm Yvette Walker on Southern California Business Report on ABC News and Talks, KMET 1490 AM, 98.1 FM, and KMET TV, talking with Dr. Aileen Dinkjian, Executive Director of Population Health at the San Antonio Regional Hospital, Randall Lewis Healthy Communities Institute, and Dr. Andres Gonzalez, Family Practitioner at Inland Physicians Medical Group, sharing an overview of a state of our community's health, offering insight, identifying challenges, and recommending solutions to our current healthcare needs. Thank you both again so much for sharing your time with us today.
My pleasure to be here.
First,
Beautiful. Perfect. So before the break, we spoke a little bit about, what the Healthy Communities Institute is, what your work aims to do, as well as Dr. Gonzalez's work on the field and what he is seeing in relation to what your studies are basically revealing, Dr. Dinkjian. So what I want to start to talk about now is let's talk about that data and what that overall state of the community health looks like today.
Yeah, so what we're learning is that, again, cardiovascular disease is still a prominent issue in our community. And it really goes back to, and it's a question to ourselves, right? How are we maintaining our health? And before we get to that point of developing maybe heart failure or even respiratory issues and things like that. And so and maybe Dr. Gonzalez can speak a little bit about patients that he sees with heart issues, but that's a really important area that continues to be a problem over time. And again, as we continue to do these assessments, that's always popping up in one of the major areas that is still affecting, and it's number one killer in America. And it doesn't matter if you're, actually women are more affected by it, but men are also affected by health failure or heart failure and atrial fibrillation. And those are things that we as a hospital always try to address. And I want to put in a plug that we have an electrophysiologist now, the electrophysiology program that's really important in addressing heart failure issues and people with atrial fibrillation. Again, also mental health and behavioral health. And I say those two things because I think people use them differently. Mental health is the mental state of a person, but behavioral health is also, the person's behavior of how they respond or react to certain situations. And so, and that's, again, contributing to some of the issues we might see. It could be homelessness, it could be food insecurity, driving that mental health state. So again, we have to try to build that foundation of how are we going to take care of everyone in our region and making sure that they have the best care, the best compassion in their communities, and that they are being taken care of and not feeling, marginalized. And so those are the two things. And the other one is maternal and child health, which is really important because prenatal care is key. And we've had, data has shown that we have children, infants falling or dropping because the moms are not capable, may not have the right support postpartum to be able to care for a new infant. And so again, another plug here is really we have a Healthy Beginnings program that San Antonio helps support families that just had, who just gave birth or have a newborn. Now what?
Right,
What? Now I got to keep this baby alive. And so, and again, that postpartum care is really key. And how do we make sure that the mortality rate, does not continue to climb? Because again, that healthy beginning really is important in how we build those families and making sure that they thrive and be successful.
Just talk a little bit about what that Healthy Beginnings program looks like and what resources are available since we have the air now.
Yeah, so Healthy Beginnings, they're just down the hall from me, and so they provide families with, not just lactation, like how do you breastfeed a newborn baby, but also support for like mental health resources or teaching them how to care for an infant, how to hold them, how to provide them with the right nutrition and the right nutrients at a certain age, and what are the milestones to expect. And so we have very knowledgeable folks that are leading that Healthy Beginnings initiative, or I'm not sure if it's centered, but it's a Healthy Beginnings program. And again, it's once the mother is discharged from the hospital, an appointment is made right off the bat, and they are seen within the next day or two, and they don't have to wait another, maybe 3 days, or trying to get an appointment with a pediatrician. But we have someone that can provide maybe even, breast pumps if you don't have any, and kind of you have it offhand right there. So or even insurance, like if you don't have insurance, let's get you covered, let's make sure this baby's covered. And I really appreciate that. And I think we have a lot of things to offer. One is, in the future, we have a birthing center that's going to be in support of in addressing the mortality rate of infants and maternal health.
Beautiful. So basically what we're hearing is that the top 3 areas that are opportunities to address our cardiovascular health, mental and behavioral health, and maternal and infant need. Now, Dr. Gonzalez, please talk a little bit about how that correlates with what you're seeing in your exam room every day.
Yes, definitely. As a primary care physician, obviously we focus mostly on the preventative health, side of it. And so I feel like my duty, my job in this is to be able to educate, to be able to engage the patient in their health, have them understand their disease process, educate them, and be able to provide resources and give them that bridge that gap where they maybe just don't understand. I have patients tell me all the time, hey, is it just a matter of just me taking this medication and that's it, I'm done? No, it's, you have to incorporate, healthy living, healthy habits, whether it be physical activities or it's, diet and exercise altogether. And so I think that that's where kind of, one of the big things as far as, a primary care physician focuses on preventative health. And that incorporates not just, obviously, cardiovascular risk, too, but, obviously, we just just had a huge pandemic, COVID, and just educating patients on, vaccines and how important those are too. And, those are also important factors too, that we need to educate the patients on and get them to realize, the importance and have them engaged and communicate to this need also too. As far as the healthy beginnings, that's another thing too, is obviously what we do. So we start young. We start with mothers and exposing them to certain programs, and I think that helps bridge this gap. One of the big things that I also feel that is very important, not just in this community but nationwide, is mental health or behavioral health too. I actually, out of residency, I actually really focused on addiction medicine too, which is kind of go into the mental health component to us also. And so I think that those are all, resources that we, need to, areas, I should say, that we need to obviously, improve on and be able to engage and educate and provide for our community. And I think that that's obviously something that a primary health, focuses on. That's something that I obviously try to do in my own practice.
Right. And so, as we know, when you're trying to bridge that gap with something that is so important, so critical, and so multifaceted, there are going to be barriers, right? So please talk a little bit about some of the greatest barriers that you have identified with your patients, Dr. Gonzalez, as to, maybe why it is they are not getting the healthcare that they need, or maybe not following through with a continuum of care, be it, referrals or additional labs or testing to, rule out any specific, actual diseases according to whatever symptoms they're displaying at the moment. Mm-hmm. But please talk about some of those barriers that you've identified and, or challenges that have been expressed to you for accessing healthcare.
Right. And, I don't know if it's a lot of it comes down to, patients just being aware of their underlying medical condition, but I try to really get them to engage and to, take this on, to kind of take ownership of this is, obviously what they, the condition that they have and, what are we going to try to do to help solve this. So I think that would probably be one of the biggest things that I've noticed. And then just making sure that they're, have, access to all these resources that are available, and to let them know that these resources are available, and because they might not be aware of certain, nutrition programs or, healthy eating and, things like that. And those are the types of things that I feel like that's the type of service that I can provide and to kind of help bridge that gap.
Right. And so what have you done, or how are you able to build that trust, right? That to ensure that they're receiving, the information that they need to make sure they're getting the best care possible?
Mm-hmm. So one thing is the biggest thing, and I go back to this, is one, we're speaking the same language. So, that the communication barrier is not an issue here. So I think that's probably one of the biggest things there is you're speaking the same language. The patients are able to engage in a conversation. They're able to express themselves a lot better. The things that we've been trying to do here in my office is, being able to incorporate, healthy livings, healthy, choices as far as, maybe I'll do like a referral to a nutritionist or something like that. And things are just to kind of get the patient to realize that it's just not, hey, take this pill, this injection, this, and then you're done. No, they have to kind of realize that that this is kind of like a whole picture type deal. And so I really try to get them to be proactive too, moving forward. With their newly, diagnosed, illness, or even if it's something that they've known that they've had for a while, but they just weren't so aware of it and what they needed to actually do for it too.
Right. And so looking at this from, let's say, a strictly economic lens, Dr. Dinkjian, as we know, a healthy workforce is a reliable workforce. And I don't know about you, but I've been hearing a lot of reports of workforce shortages, right? So when you look at the economic impacts that not having a healthy workforce can have on a business, what are you finding through your studies?
Yeah, so if we don't have, let's say, for example, they're not engaged in, in their care in general, they're less likely to not appear in the business setting or even come into the hospital or going seeing the doctors. And yeah, there's that economic impact, the business impact side. But also, I think one thing I want to address real quick too with Dr. Gonzalez is that you'll be happy to know that we also provide, community lectures both in English and in Spanish, because I think there's that little relief when someone starts speaking your language that they are more likely to come see you more often and get those screenings done, right? So, and I think that's the most important part economically, which is how do we not only build that workforce with the population that we want, we're seeing in the hospital who are more likely to get sick by or have these health problems, chronic diseases, and be treated by someone that actually can relate to them, even just by how they can speak to in their language. And one of the things that we are working on is partnering with a local university on Spanish terminology, medical terminology, which is important, and also creating this this opportunity for people that are not even maybe not clinical, non-clinical professionals like public health professionals like myself, to learn the language and also be able to speak to the community. And so our hope is that we will drive the workforce, because yes, there will be about 500,000, for example, nurses missing in the field. And by 2030, and what does that mean? We have a growing aging population, and who's going to address those individuals when that's going to be us. That's going to be me, getting to that place where we need to really support that workforce of the younger generation. And especially if a lot of them may not understand, may have been traumatized by what they've seen by the pandemic. We want to educate them that there's a reason why they're in this field, why this field is important, how it impacts the community, how it impacts their families, and the value behind it. When you care for someone, because at some point I always say to others is that we become caretakers of someone, whether it's a young child or an older person, and having that exposure in the medical field or in the clinical setting really prepares you a little bit more what to expect and how to navigate your health and navigate the system. And we need more of that. We really need more people, like you said, Dr. Gonzalez, that as a child you were kind of like that navigator for your family. And so let's make it official and have someone that really can speak that language and support their own families there. So
I love it. So with that said, Dr. Dinkjian, please talk a little bit about the plans or strategies to address, the prevention of chronic illness, access to healthcare, continuum of care, et cetera, particularly in those fields that you described earlier, which was cardiovascular, mental, behavioral health, and women and, maternal and infant health as well.
Right. So the number one problem that most people, the biggest barrier is really, I don't have health insurance. It's the bill's going to climb. I'm not going to go see anyone. And there are community clinics that folks can go see. But also we offer, for example, free mammogram vouchers. And I mean, this is just an example of what we can do. It's as a low hanging fruit of getting people to just come and get screened, catch things early on, and don't be afraid to do it. And that takes work, and that takes a lot of education in multiple languages. And our hospital does provide translators as well, for anyone that needs it, needs to understand how do I take care of myself. And so program wise, I mean, I've mentioned some of the things that we're doing at the schools, but also at the community level. We're continuing to do our HPV education. We are planning to utilize our community spaces. Recently, we have a grand opening of our urgent care opening up this Friday, actually, in Ontario, where there's more access to a hospital should there be a need, but also there are community rooms that we're planning to utilize around our area to engage people in understanding what is a screening, why is it important to me, how can I get enrolled in a health plan or healthcare. And so those are the work that we are doing, have been doing, and continue to do. It does take a lot of collaboration. And we talk about, it's kind of like a mosaic. We have to really just connect with each other, with different organizations, with businesses, with other hospitals, in order to really take care of our community. And so that's the plan moving forward. So we just need to build those connections and continue to connect the dots of, okay, I can't do everything alone. We can't do everything alone.
Yes, I
There's
love
no
that.
way. Yeah, we just can't. And so being partners and, in health, being partners in our community, being stewards of what we are, what we're seeing with those that are of much more need, who are underserved. There are experts out there that are doing that work, but we need to be able to partner and say, hey, let's figure it out. And one thing I want to put another plug is that there's an IE Connect. I don't know if anyone's familiar with that, but it's something that has been built out by several community-based organizations, including IEHP, where IE Connect and United Way, I should mention them as well, United Way, where you can just, it's kind of the Google for resources, in our region, specifically curated to our region. So
IE Connects, what is the website for that? Really quick, Dr. Dinkjian, please.
It's ieconnect.com, I believe. And it's phenomenal. I think if people look it up, or just even Google IE Connect, or Connect IE, you'll just get information on, where can I get reduced cost services for Medicare or for job training, or things that really gives them that foundation and that support that we're talking about, which is like, if I'm not financially supported with a job, maybe I'll go in this thing and find a food pantry to help me in the meantime, so it's kind of, like you said, we have to start bridging these gaps, and then you can type in the zip code specifically where you can get these, places. And I've done it. I've looked it up, and I was like, wow, I didn't know this existed. And, and we don't. I think that we know that we have so many hidden gems in our region.
We do.
And we just don't know about it. So, but this place is like a good start to just get to, not even Yelp will tell you what that is.
Right, absolutely. And that's what this platform is for, exactly for that, to elevate and highlight those resources and those messages that are so valuable and critical to our communities. So thank you so much again for being here and sharing that. So Dr. Gonzalez, please talk a little bit about what are some rules of thumb when it comes to getting regular health checkups and establishing, a baseline of, what your patient's health should be, where it's at, and, is it an annual checkup? Is it, what does it look like?
Yeah, I'd say, at the very least, it should be at least an annual checkup. I also kind of tell patients that, depending on their, past family medical history too, maybe they should be seen more often, look into different disease processes. But yeah, at the very least, I would say annual checkup. Obviously with certain people, if they have more chronic conditions, we're going to see them more often. We're going to have to monitor them, more often, where they'll probably be coming in monthly, if not weekly, until we kind of get them a little more stable as far as their conditions. But, overall, I would definitely have to say at least annual checkups would be the biggest rule of thumb to start with.
And just, can you give a brief description? What does an annual checkup entail for a woman? What does an annual checkup look like for a man?
Yeah, so of course you have to break it up into age categories, right? So obviously a woman in the productive years, you're going to talk about, mammograms, breast cancer screening, colonoscopies, pap smears, cervical cancer screening and stuff. So you have to break it up into kind of categories. And obviously you're not going to be able to do everything in one visit. And that's something that I always tell patients, because they come in with their list of things. And so, you're not going to be able to do this all in one visit. And that's actually one of the biggest things that, challenges that I face too, is that the patients come in with their list of things and I have my list of things, and we kind of have to meet together and kind of, compromise as far as what I think is important and what they think is important, and be able to kind of, mesh and to be able to, so they can actually think that they're being heard too. Because if they don't feel like you're listening to them and taking their issues into consideration, they probably might not be coming back to you too. So, so that's something that I think is a big step too for us moving forward.
And for men also?
Oh, men, yeah. Also, obviously, colonoscopies are probably the biggest things, where we pretty much start at age 50 for men. Prostate screening too. Obviously, if somebody has some of the risk factors, some of the symptoms, and then we're probably going to end up referring them out to a urologist. But probably from just age 18 and above, it's probably more driven based off their family history. Whether they have that cardiovascular risk, whether it's diabetes, so you kind of everybody's kind of just driven based off of their risk factors and their family history. So underlining, so nobody's really, just, by the book, if you will. So you kind of have to factor in all those things.
Beautiful. All right. Well, thank you so much both for sharing your expertise and giving us a bird's eye view of, what we need to do to maintain our health, what the top 3 challenges are, which are, again, cardiovascular, mental health and behavioral health, and maternal and infant care. So everybody, don't forget to, check out those resources that we talked about. Thank you so much for being with us here today. For everybody listening now, look for us on Facebook, YouTube, LinkedIn, and Instagram. Check us out on scbrtalk.com, and don't forget to download the free live streaming app on Google Play or the Apple App Store. Don't miss my interview with Jose Ulloa, who is best known as the Latino Cyber Guy. Having started his career at Latina Style magazine in 1997, he created and presented on a national scale a seminar focused on educating business owners to make informed technology decisions in purchasing and application. Jose quickly rose in the media ranks through his efforts in radio by developing and producing the only Spanish-speaking technology show on national broadcaster W690 AM. Jose has been featured and aired live during TV segment #1 morning variety shows, including Telemundo's De Todo Un Poco, Fox's Good Day LA, and Univision. He has made it his mission to educate consumers, especially in the Hispanic community, which has been recognized to drive spending in the U.S., reaching $1.84 trillion in 2020, and it's projected to soon reach $2.6 trillion in purchasing power, according to Bloomberg Linea. Next week, we will have Romulo R. De Leon. He is the founder and CEO of Coral Reef Development Group, bringing over 40 years of business experience in marketing, commercial, and industrial products across LATAM. As then president of both Paramount Enterprises and the U.S. Panamanian Chamber of Commerce in Los Angeles, Romulo promoted business relations between Panama and USA. He assisted in the adoption of the North American Free Trade Agreement among the U.S., Canada, and Mexico, doing multiple speaking engagements to chambers of commerce and the general public in conjunction with his community outreach programs. He has served as commercial and trading advisor to Costa Rica's consulate in general in Los Angeles, California. Romulo has represented General Electric and other leading corporations for America, Europe, and Israel in trading industrial and commercial products to and from Latin America. So we will see you next week, everybody. Do not miss it.